Hello, and thank you for joining me. My name is Jenna Jensen. I'm the Chief Informatics Officer on this project to improving emergency response times and enhancing patient outcomes. Effective emergency response is essential in reducing complications, improving patient outcomes in a clinical, fast-paced environment. Any miscommunications or delay can lead to poor outcomes during these critical events, and this goal of this project is to enhance coordination of emergency response times during these clinical settings. Focusing on emergency response is vital, especially due to inpatient cardiac arrest or sudden acute deteriorations, which require immediate action from the healthcare team. And we've identified that these gaps in communication, role clarity, and rapid response activation can help improve the team preparedness to help better patient outcomes and survive with quicker recovery times. A quick emergency response time can be the difference between life and death for a patient, and a faster response time leads to better prognosis, proper team training leads to fewer errors, and improved coordination leads to better handoffs for improved continuity of care. Hopefully by the end of this PowerPoint, you'll be able to recognize the signs of patient deterioration within 2 minutes, hopefully, and properly activate the accurate emergency response protocol and demonstrate accurately portraying team roles and communicating to improve patient outcomes. With one of the ways I use is through an SBAR. To reinforce these skills, I plan on using role-based scenarios for team coordination, online learning modules, interactive workshops, and more specifically simulation-based training using SimCapture for code blue, stroke alerts, and trauma for more critical emergency response situations. These simulation-based tools help promote realistic scenarios, give proper feedback from experts to promote and improved patient outcomes in a realistic clinical environment. And the use of SBARs, code role badges, and labels with communication cards help improve the coordination and enhance patient care during these critical events. The resources that we currently have are simulation labs, mannequins, unit educators, and code team leaders to help activate and properly coordinate emergency protocols, but what we are lacking are the code identifiers, the proper training hours, and the flexible staff schedules to allow them to attend these meetings, and better AV equipment for scenario recordings to give proper feedback in those scenarios. Our 6-week plan begins with coordinating the team, getting the materials together, on launching the online simulation sessions, but by the 4th and 5th week we should start debriefing, collecting feedback, implementing those changes, so by the 6th and final week we can start tracking those reviews and start implementing those patients for improving real-life patient outcomes. I will have the unit directors and nurse managers post flyers in the break rooms, reach out to their unit specifically. I will send out email reminders, and I will talk to the specific units in ICU, ED, telemetry, and if there are any nursing students that would like to attend, reach out to their CIs and have them message me for any ones that would like to attend. If a problem does come up, we do have a couple contingency plans in place for if someone happens to miss one of these meetings. We'll have another makeup session. If there's a too high of a patient load, we'll try to fit somewhere in the flexible schedules, but if it's somewhere on our end with the tech issue, we'll go back to having in-person simulations and with cards and hand-printed checklists. Our formative assessments will be pre and post tests. We'll be doing observational assessments during the simulations. For the summative and long-term evaluations, we'll be looking at response time scores, analyzing the data, and patient safety trends that align with the data that we've collected. To recap, emergency response saves lives, helps build confidence and coordination amongst healthcare teams, so we need to commit to help improving these patient outcomes. Please encourage your unit to participate and encourage them to give us feedback to continually improve our outcomes. Thank you for giving me your time, and I will take any questions, comments, or feedback at this time.